Do you have anybody in the waiting room?
Just getting the last person out of the waiting room. So we're good.
All right, so I'll repeat what I said before. We're going to change the agenda slightly with the concurrence of the members. The first two items I would like to defer. We have a number of people who want to speak about what's the changes that are proposed for the Sharon Hospital. There was a presentation on the agenda relative to an update on what's going on with the hospital. Then Curtis and a couple of the selectmen in that area would like time to make comments also. So we're going to do that first. And then we'll go back to the agenda items we skipped over and the other agenda items. And with the goal of trying to still adjourn by noon, because in the past meetings, we have made a more active effort to stay with time and not run too far over. But this topic is an important topic for us to cover. So why don't we start with the public comments? And I think Lydia Krug-Moore is sort of leading off with that.
Yes, hi, thank you very much. I'm Lydia Moore, and I am a co-founder of Save Sharon Hospital, a resident of Sharon. As you can see today, there are many community members who are hoping to speak during the time for public comment. We are all very concerned about the changes Nuvance is proposing to Sharon Hospital. And if you permit us all to speak, you will see that we represent multiple stakeholders, not just the young and the elderly within our community, but also physicians and independent schools. We have worked hard to ensure our commentary is concise and without repetition, and we hope that you will hear all of us and raise our concerns to the state, and in particular, those at the Office of Health Strategy. So I will start with my own testimony. As a mother of two young children who were born at Sharon Hospital, I regularly meet other mothers who are shocked to discover that maternity is still open. They thought maternity had been closed, otherwise they would have delivered there. Despite being the target demographic, Nuvance has failed to show these women that Sharon Hospital is an option for labor and delivery. In fact, they have gone so far as to turn pregnant women away, like our friend who moved here at the beginning of the pandemic and was told by the hospital that she could not deliver here. It almost seems as if Nuvance is sabotaging maternity so it can force patients to its other hospitals. Another example, when Dr. Trias, the new Milford OB, left in 2018, Nuvance did not replace him despite him delivering approximately 60 patients a year in Sharon. Today, Nuvance will show you a decrease in deliveries over the past few years, but I ask you, what part of this decreased volume is actually due to Nuvance negligence? Elected officials, please represent us to the Office of Health Strategy and tell them to reject Nuvance's ill-conceived plans. Thank you.
Maybe I'll speak.
Yeah, Lydia, I'm not going to call names out. I know you had a list in an order, so I assume you can manage that. Or
I'll call people. Next is Dr. Howard Mortman, an obstetrician.
Hello, my name is Dr. Howard Mortman. I live in Sharon. I've been a full-time OBGYN delivering babies at Sharon Hospital since completing my OBGYN residency at Yale 30 years ago. I have three brief but important points today. First, 2 weeks ago, Nuvance presented plans to the hospital's medical staff to close the world-class labor and delivery unit at Sharon Hospital and significantly reduce surgical services, among other things. A secret vote immediately followed, and the medical staff of doctors and nurse practitioners voted decisively against the proposed changes 25-1. The vote was secret to protect individuals' privacy so they would not suffer potential consequences from Nuvance. Your medical staff does not support the significant disfiguring proposed changes to Sharon Hospital. Remember, that's 25 against, 1 in favor. Second, the American College of Obstetrics and Gynecology was hired by Nuvance to thoroughly evaluate the safety of our program. That was this year. We felt, along with several high-risk OBs in this area, that Nuvance was merely hoping we would do poorly so they can shut down our unit. Ironically, NHCOG felt very strongly that we provide a safe and loving environment for having babies and are an essential service here. They unanimously supported the need for providing labor and delivery in our rural environment and recommended every effort be made to preserve it. Those recommendations have not been addressed by Nuvance. And finally, Nuvance has suggested that it is important to recruit OBs to this area, that it had been impossible to recruit OBs to this area. That's untrue. My practice has recruited the star obstetrician from NYU. Amazingly, Nuvance would not give the standard financial guarantee offered to newly recruited physicians so that these recruited physicians can survive initially. In spite of this roadblock, the new doctor is coming, but with no support from Nuvance. Selectmen, I urge you to take the commentary you hear today to the state level. Nuvance cannot be allowed to make the proposed changes to Sharon Hospital.
Thank you, Dr. Mortman. Next, we have Dr. David Kurish, who's an internist and cardiologist in the community. All right, it looks like he is not available at this time. So we'll go ahead and skip on to Joshua Hahn, who's the assistant head of the Hotchkiss School.
I'm sorry, I don't have a prepared statement, but I want to emphasize that the school does not support these changes and is sees the maternity department at the hospital as essential for us to attract and retain employees and faculty at the school.
Thank you so much for that, Mr. Hahn. Next is Jody Soja, the head of Indian Mountain School. All right, I don't see her yet on the call either. The next person is Richard Tuberville, who is a New Milford resident.
Good morning. My name is Rachel Tuberville, and I live in New Milford. I feel, based on my own experience, very uncomfortable with Nuvance's plan to cut vital services at Sharon Hospital, specifically labor and delivery. On June 13th, 2018, I was living in Millerton, New York, and was 33 weeks pregnant. My husband was out of town, so I was home alone. That night, I woke up with excessive bleeding. My OB instructed me to go to the closest hospital immediately. I drove the 10 minutes to Sharon Hospital instead of the 50 to 60 minutes to Northern Dutchess or Vassar. Within minutes of my arrival, and while still hemorrhaging, the obstetricians arrived and notified me that I was experiencing a placental abruption and my baby was having heart rate decelerations. Without Sharon Hospital having OBs able to perform an emergency C-section or having an open operating room in the middle of the night, the odds of both myself and my child surviving would have been minuscule at best. As selectmen, I would urge you to consider what would happen to a woman if she were to arrive at Sharon Hospital in the same situation after the closure of labor and delivery. Thank you.
Thank you, Rachel. Next is Nick Moore, Sharon resident.
Good morning. My name is Nick Moore. I live in Sharon. Our daughter Gardner was born in 1988 at Sharon Hospital. Sharon OBGYN is a jewel in the Nuvance system. I was part of a virtual interview with Sharon with Stroudwater about Sharon Hospital on April 14th, and I stressed the importance of keeping labor and delivery as being essential to maintaining a full-service hospital. All I've heard from the Stroudwater report is secondhand since then. Carrie Eaton of Nuvance said on September 29 that only 60% of women living in the hospital's Connecticut coverage area choose to deliver their babies in Sharon. The central issue that Nuvance intends to shut down labor and delivery. I see an opportunity to market and recruit for our highly rated Sharon OBGYN because we have a great facility and excellent doctors and nurses in the practice. The finances of Nuvance, in my view, are murky, and COVID hasn't helped. Sharon Hospital is not a bank branch, and we don't have other full service options in this part of the world. Our community, and that includes municipalities in the tri-state area, independent schools, churches, businesses, weekenders, and residents, need a clearer understanding of the finances of Sharon Hospital. The full services we've known and depended on at Sharon are at stake. Thank you.
Thank you, Nick. Next up is Victor Jermak, Sharon resident.
Good morning. My name is Victor Jermak. I'm a Salisbury resident, and have been involved with trying to keep Sharon Hospital as a vital community resource for over 20 years. Nuvance says that they have to make several major cuts in service due to operating losses of $41 million since they purchased it. The fact is, audited financial statements and OHS data just do not support or confirm this. As a forensic accountant, I can't confirm their losses, and I just don't see them. Nuvance has mismanaged the hospital from the start by letting vital services go, such as pain management, urology, neurology, sleep medicine, etc., forcing patients to go elsewhere, not hiring primary care physicians, not advertising, and by senior management turnover. And even today, Dr. Herco is just part-time. He runs another hospital. We urge you to see the evidence on the other side of this issue and let us show it to you in great detail. And please contact your state representatives and let's see if we can make this happen. Thank you.
Thank you, Victor. Next, we have Kathleen Freeman, Sharon resident.
Good morning. My name is Kathy Friedman, a longtime resident of Sharon. It's difficult to see how the planned cuts won't adversely affect the very services that Nuvance claims it will promote to keep our hospital sustainable. Primary care, senior health, women's health, orthopedics, not to mention the chilling effect on medical staff whom Nuvance must retain. How will primary care doctors view curtailed hours of surgery or reduced ICU, gaps in other areas that remain unfilled? Crudely speaking, what's proposed resembles treating a fractured leg by shortening it section by section until there is no leg and calling it physical therapy. Relatedly, financial details, including accounting and billing, have been kept from the community and apparently even from the medical staff. Where, for example, are the figures showing the financial relationship of our hospital and its various departments to Nuvance's other facilities and practices? This is a crisis of first order for our community, and I suggest the process of cuts and restructuring be immediately paused for open and unconstrained deliberation, including doctors and members of the public. Thank you.
Thank you, Kathy. Next, we have Jill Drew.
Hi, good morning. I am Jill Drew from Sharon, and I oppose the Nuvance plan to cut services at Sharon Hospital in the name of transformation. Every week, I see large ads in our local newspaper for doctors from Hartford Healthcare. It clearly wants our business. It's not clear Sharon Hospital does. I see no evidence that Nuvance is using the quote, commercially reasonable efforts, end quote, to attract doctors and patients to Sharon Hospital, despite promising the state in 2019 that it would do so. Then, like now, Nuvance promised a rosy scenario, a 6% increase in inpatient volume and operating gains of more than $3 million a year at Sharon Hospital. We are now told that those projections were wildly inaccurate. Now, we all know that COVID happened, but now Nuvance appears to be capitalizing on pandemic upheaval to close down vital services rather than doing the hard work to attract business. I do not trust the quote transformation Nuvance promises, and I fear for the health of our region. Thank you.
Thank you, Jill. I think that Dr. David Kurish is now online. Dr. Kurish, would you like to go next?
Yeah, fine. I'm Dr. Kurish here, an internist and cardiologist who spent 43 years trying to help the residents of the Northwest Corner and Eastern Dutchess County. I, along with almost all active members of the Sharon medical staff, do not support the present Nuvance proposal. Because of Nuvance's proposal to close maternity, the ICU, and after-hour surgery, a group of 12 senior medical staff members formed a leadership council in May to negotiate with the against these draconian cuts. We met every week or two all summer to address our concerns and raise our objections. We met with Mr. Murphy, Dr. Murphy, the CEO of Nuvance, Dr. Herco, the president of the hospital, Easton, Eaton, the CFO, Sharon Hospital board members, and others. We were sworn to secrecy during this process as we were given sensitive insider information. Unfortunately, we had very little impact. On September 29th, Mr. Herco presented the new VANS proposals to the meeting of the medical staff. After Mr. Herco's presentation, there was extensive discussions. Since the majority of the employees, since the majority of the doctors on the hospital staff are employees of the hospital, we asked the administration to leave after the discussion so we could have a deliberation and vote. At the vote, the staff voted 25-1 against the proposals. There are four main reasons why we voted against these proposals. Number one, the track record of new VANS in recruiting doctors was abysmal. They have recruited 5 primary care doctors in the past 2 or 3 years, and all have left. Retiring physicians in neurology, urology, and internal medicine have left. Other doctors such as ENT, pain management, and sleep medicine have left, and they've not been replaced, leaving a void and backup for the primary care doctors that remain
Dr.
on the
Kirsch,
staff.
I think we're losing you.
Okay.
Oh.
On September 29th, Mr.
Dr. Kirsch, we can't hear you.
Well,
I
that
think you
happened
might be on mute.
intentionally. Let's see.
Okay, Lydia, how many more people do you have? I also have.
We have one more person that I know of, but I'm not sure.
Well, I
if there
see
are
some
other
hands
people.
up, but I don't want this to go on forever because I think the message is very clear. Because we still
Okay.
have presentations and we have the rest of the meeting. Jocelyn, could you text those 4 people with their hands up to see if we need? Well, and what I'd like to do now, if you have one more person, let's do that one person, then let's switch over, let Sharon Hospital make their presentation, and then we'll go to the selectmen. But I see
Could I make another suggestion, Don?
Sure.
This was actually Maria Horan's suggestion. Anybody who doesn't have time to speak could also put their comments in the comment box, and we could, in the chat box. We could make the chat comments public as part of the record for the meeting as well.
Yeah, because right now it's, we're gonna run out of time, and I think, for a lot of the selectmen time, they're limited on the availability. I would like to do one thing. Senator Whitcoast, and I know he doesn't represent the far Northwest, but he asked for 1 minute on another topic before he has to leave. So Kevin, if you want to unmute yourself and talk, and then we'll go to Sharon Hospital.
Thank you, Don. Good morning, everyone. I'm glad I'm on this morning to hear some of the concerns regarding Sharon Hospital. I don't represent Sharon, but I certainly am glad to hear what the advocates are saying and the folks that work up. I just wanted to say to the folks that are retiring, congratulations to the women that are not re-election. It's been a pleasure working with you all these years. And lastly, Steve Silver, who is my colleague at Eversource, he's been out. He had surgery the other day. He's doing extremely well. The surgery went well. So I just want to pass that along. I know he'd like to be here in person and be up on his feet very soon. And I'm covering a lot of his communities during his absence. So if you need anything regarding Eversource related issues, just feel free to reach out. Thank you, Don.
All right, thanks, Kevin. Okay. Lydia, you said you had one more person who was scheduled, or?
Oh, yes, that'd be wonderful. Thank you. Less than a minute. Leslie Moore. Leslie? Oh,
You have to unmute yourself.
you're on mute. Go to the top right, the blue.
Can
Can you
Okay.
hear me now?
Yes.
Yeah.
I'm very sorry. I'm Leslie Moore. I'm 75 and I've been a full-time resident of Sharon for more than 40 years. I'm here to speak for the maternity services and the hospital in general. In the winter of 1986, I had a spontaneous miscarriage and began to bleed profusely. Fortunately, the hospital was closed. Otherwise, I wouldn't be here to speak with you today. Dr. Schnurr met me at the ER. It was clear that there was a team around working as quickly as possible, but I could see a lot of blood and I was afraid I would die. In the OR, Dr. Schnurr and his team saved my life. I recovered. And 2 years later, my daughter was born in Sharon Hospital. Because of maternity services, there was an anesthesiologist and an OR ready when needed. What happened to me is not unusual, and it is life-threatening. Having the hospital close by certainly saved my life. Because of this service vital to our community, I was able to watch my children grow up and watch 2 of my grandchildren born at Sharon Hospital enjoy living here. Please do not allow New Vance to remove this vital service to women, to their families, and to our communities. Thank you.
Thank you so much, Leslie. And thank you, Mr. Stein and all the other elected officials on this call. We really appreciate you taking the time to hear us today. Thank you.
And I think Jocelyn just posted that anybody else who wants to make a comment, I see there's one in the chat box. You can make it here. It'll be part of the record. With that, let's go to Sharon Hospital.
Chairman Stein, is the public comment period over? Because I had a comment not related to the Sharon Hospital. Is it possible to make that comment?
Who's that speaking?
Oh, sure. It's Carolyn Nastro.
And why don't you go ahead if you can do it under a minute?
Yeah, sure. So basically, I noticed that the annual report is on the agenda, and that Mr. Phillips will be speaking about that. And I wanted to thank Mr. Phillips for his communication with the public lately. It's been very much appreciated, the transparency, the information that he's providing. And I think one of the questions that's a bit confusing is related to how the COG kind of funds its operations. And I noticed in the annual report that certain grants are allocated to different operations at the COG. And then we've also heard that certain salaries are fixed and certain costs are fixed. And so I'm just wondering if he could explain a bit more how that works. And I've also noticed that he's recently has changed the COG practice of allowing employees to work for towns as COG employees. And that's now, it's now required that those employees work as individual consultants. So I was just wondering if that was related to this kind of perceived conflict of interest that people have been speaking about related to, grant administering and funding coming in, and whether he'd spoken to the OPM and received guidance about that. So if he could just address that during his period, that would be really amazing. Thank you.
All right, Rob, I assume you took note of that. I don't know that we can answer all those questions at the time allocated, but we will, Rob, I assume you'll try to address those issues.
Sure, under my report.
Well, when you're doing your report, which includes the annual report.
Sure.
All right, with that, let's, next up would be Andrea. I assume it's Ren or Ryan. I'm not sure which from Sharon Hospital.
Actually, it's Dr. Mark Herco, president of Sharon Hospital, presenting.
Great. And Andrea, if you can, if possible, call up the presentation. Thank you, Mr. Chairman, and all members of the Council on Governments for Northwest Hills region. Really appreciate this opportunity, and everyone else that are actually here for a meeting today. Here's what really we wanted to discuss. We wanted to kind of go over our vision for the future. What is the background and landscape of our decision? What was our planning process? And then what the plan is, what are our next steps, and what are the future, any questions anybody has. Just to reiterate, this is just the beginning of this process. We have a ways to go as we go through this entire multi-phase implementation, and that's why we want to really get the word out through town hall meetings at Sharon, which we will be initiating in early November with small groups being COVID compliant, and we will also look at other venues throughout the region that actually serve Sharon, just so everyone can have a direct contact with us to kind of go over their concerns about various aspects of the plan. Next slide, please. So what's our background and landscape, where we're going? Here's the reality. Rural hospitals are closing. Since 2005, 180 have closed, and in the last decade, it's 138. You can see this is rapidly expanding, and there are an estimate of 40% more closing at any time. Of note is that since COVID started over the last 18 months, on average, one rural hospital closes every 10 days in the United States. And if you check the various healthcare magazines and or websites that'll actually show you all the areas where the hospitals are closing. And Connecticut is not any different. Next slide. Most recently, the Center for Healthcare Quality and Payment Reform identified Sharon Hospital as at high risk for closure. And Sharon is not different than any other rural area in regards to the inability of maintaining finances or volumes are leaving. So really, there's been an ongoing planning process necessary to really adapt to this reality. And this is unfortunate, but this is the reality of where we are today. Next slide. So how does Sharon follow the trends? Well, as mentioned during this earlier part of this meeting, there is a need for primary care providers across the service area. And like any other rural area in the United States, it's very difficult to recruit those physicians to the area, let alone keep them, for many, many reasons. And we're working on finding a solution there. There is, with an aging population that is occurring in the northwest corner, as you can attest and look through the various Connecticut websites going over the aging population, particularly Litchfield and this whole region. There is an increased need for specialty care, outpatient care, which is where medicine is going. Medicine is not hospital-based in the United States today. 75% is ambulatory and outpatient, and also behavioral health services. Literally in Connecticut, there's a higher risk of dying of substance abuse overdose than there is of a car accident today. So it's really disconcerting that we're seeing this. So these are the areas where growth is necessary. What does Sharon do really well? Well, we've looked internally, we've had external reviews that Sharon is really good at identifying patients as they come through, determining what it can care for and what we can't care for, and transferring and referring patients to other areas within our health system or even other health systems that can offer those advanced services. And we, on average, do this 275 to 300 times per year since we have since HealthQuest actually purchased the facility, and then Nuvance has only been an entity for 2 years. So anything before 2019 really was another health system. That we are Nuvance. So shifts in healthcare delivery, particularly, have led to decreased usage of many acute inpatient services, including critical care services, surgical services, particularly non-elective cases, i.e. emergencies. The majority of any emergencies that have been occurring actually have been a C-section type cases that have been after hour, weekends, or holiday type schedules. And then obviously labor and delivery is shown here. Next slide, please. So what was our planning process? So in our almost 2-year process, we looked at our internal data and looked at where we're really good and where we aren't in regard to being an active member of a very large health system. We looked at our demographic trends throughout the region, which differ from other regions that other hospitals care for. We looked into other rural and community hospitals' approaches. Just since we have purchased this facility, 3 hospitals in the northern New York area and Long Island and 1 in Connecticut have shut down their labor and delivery services for similar reasons as we are now considering. We also did internal review of healthcare trends. We looked at the community forums that have occurred in the past and most recently. We even, through the Foundation for Community Healthcare and our board, who made suggestions that we bring in an outside third party who are experts in rural healthcare, that considered the experts, particularly on the East Coast, which was at Stroudwater Associates, to really look at what's going on currently, what were their suggestions, and they looked at the plans that we were considering. And then we had, as mentioned earlier, conversations with the Sharon board, conversations with medical staff leadership and the Foundation for Community Health. All during this period, over the last 3 years, Sharon has lost almost $40 million, with an additional anticipated loss this year of $21 million. And that was, it was $19 million going into the last month of the fiscal year. Next slide, please. So what were the recommendations for Stroudwater? So as noted, you had multiple other inputs of information. The Stroudwater report and Stroudwater evaluation was not the be all or end all. It was actually one data point that we used to really help make a decision of where we were going. And actually there was about an 80 to 85% concordance of what they found versus what we were considering to do, which was, Sharon is really good at being effective within a health system. If we didn't and weren't a member of a larger health system, especially during COVID, Sharon Hospital would not be here today. They recommended maintaining inpatient program and really using a thing called acuity adaptable beds, where patients of various health severity can be seen in one unit, and actually their level of care can actually fluctuate, and therefore we would adapt that. And by having it in one unit, it would be easier for staffing purposes, which has been, as everyone sees nationally, very difficult when 18% of all healthcare staff have actually quit since January of 2021. This has been a difficult issue. Growing inpatient psychiatric unit. Again, grow outpatient services. That's where healthcare is going today. Invest in primary care. Everything that everybody is stating, we agree. Maintain and grow community support. We are working on that, and we love the engagement that we see here today. Realign our system, especially as we have, we've merged into a larger health system, and look at how those consequences are helping us in the long term. And again, finally, suspend labor and delivery. And with that, modify our schedule, since there was a diminished need for those emergency services at night. Next slide, please. So here's our transformative plan. Again, we aren't just taking what Stroudwater had stated. We had used what we had considered and looked at both internally. We also had 2 internal audits and reviews by companies looking at where we're going. And then as a health system, we actually have had 2 separate external audits of our financial reports over the past year. And our 990s are currently on file and for the public record for everyone to view. But if you look at our overall plan, it's investing, enhancing, and adapting. And if you look, the majority of where you're going is building, where we've built in service lines to invest in primary care, cancer care, heart and vascular care, which we're very strong on, particularly cardiology, and build up neuroscience. Again, specialties that are very difficult to bring into a rural area. Being part of a larger health system, we are leveraging that to build those areas. We'll start small with the telehealth and then move forward as the services are recruited into as a system level, and then they'll actually then be able to rotate over into our area. Partnership with the federally qualified health center from Torrington. We have have an agreement with them that their mobile van will be parked in our hospital region, in our lot, and they'll be actively seeing patients by the end of this month. And then over time, we will be working on it, having them a permanent status of clinics within our hospital itself and our facility, and also assist and work with them in their permanent facility in North Canaan when that facility is completed. This is another aspect of investing in primary care. They have capability and people that actually can see a lot of the patients in the region. So that is a very strong aspect of care that we're proud to say that we've been able to move forward with. And then looking at our behavioral health services, which are actually a very strong positive in our region, in our state, and build upon that. And then look at and explore building an adolescent adult spectrum autism program to assist both inpatient and outpatient methods. So that's investing. And we're going to advance and enhance services, particularly optimize our surgical schedule. We never stated or mentioned in any public statement or privately with physicians exactly what we would do with the surgical schedules until we actually had labor and delivery shut down and phased out, because then we would see what other possibilities and capabilities we have. We want to build the outpatient realm, and therefore we have increased capacity capacity for outpatient services and outpatient surgeries during the day, and can maintain the ability of doing the occasional case, particularly hip fractures and other issues that occur in our community more so than other communities that other hospitals in our system care for, and then adjust the schedule accordingly. And that's where we're working, and those teams and work groups are initiated, and that team will be starting next week. We're also looking at optimizing and evaluating our inpatient care delivery, since at any moment, only 40 to 45% of our inpatient footprint is actually being used. The rest of it sits empty. And we have to utilize this better if we're going to care for the greater than 30 communities that actually utilize our facility. So we actually initiated that team as part of our ICU evaluation team greater than 3 months ago. And actually earlier this week, we again had another meeting with that group as we look at how do we look at consolidating our inpatient footprint into a large unit that actually can have flexible beds and offer care to almost all the patients that we care for today. So that's where we're looking there. And then we want to revitalize the unused spaces, particularly utilizing the FQHC if they want to open up a clinic there. We want to use digital enhancements and telemedicine to upgrade the facility, becoming a hotspot for our population, which has difficult times with Wi-Fi. They can actually utilize our facility for their televisits, and even then they can coordinate their lab and their radiology scheduling with us. This is the way we evolve into a community-based hospital that fits the needs that we are currently having, not what we had in the 1980s or 1990s. This is a different system. And on top of all that, I want to thank Congresswoman Hayes for actually earmarking $400,000 for us for the digital enhancements. We're just waiting for Congress to approve those. Now, for all of this investment and enhancement, we have to actually encourage or incur some cuts, and the cut is phasing out labor and delivery. Currently, that service loses almost $5.1 million annually. It's not just having a labor and delivery unit. It's you need 24/7 coverage for surgery, 24/7 coverage for OB, 24/7 coverage for anesthesiology, 24/7 coverage for maintaining a unit, a minimum of 2 nurses at all times, even if no one is there, 24/7 OR team coverage, 24/7 pediatrics, all that for less than 3 babies per week. That's where we're having difficulty in maintaining that service, and it has nothing to do with quality in regard to this decision. Next slide, please. Oh, looks like we froze there. So as we move forward, we're going to have various steps. Looks like we froze, sorry. Here we go. So for our next steps, as we expand primary care and ambulatory care, we really want to treat issues earlier, again, to keep people out of the hospital, improving our outcomes. So we've partnered with Torrington FQHC. We will apply for a health professional shortage area designation, which takes 18 to 24 months. This will forego the need for foreign medical students who are currently enrolled in our residency, some of our residency programs, from having to go back to their parent country. They can actually utilize and come directly into the job market after completing their training. FQHC has that waiver, and we will be working with them to gather that further as we work with the state. We're also going to continue and evaluate our recruitment and retention practices, and we've met with our board and with some members of the community over the last few weeks to further iron out how we would do that, again, showing the strengths of what this community has to offer. Increased access to telemedicine, that has actually been underway for the past few months, and we're to a point where we want to open up some rooms that people will be able to access and utilize for their telehealth visits, and then move forward with that as we have our rotating specialists throughout the health system in those hard to serve specialties, see and help patients there, and then gradually increase a face-to-face type of practice, and then establish those clinics as noted. Next slide, please. In regard to behavioral health, evaluate our current unit. We're capped currently at 12 beds, even though we have 16, and there is a very long wait list to have people come in. Unfortunately, the staffing is very difficult to maintain, let alone recruit in. Again, the same issues we see in the emergency rooms nationally and in other med-surg units, and we're working on maintaining and improving that. And as we look at our behavioral health needs for the demographics in our area, we need to increase that capability. And we will outline, our potential plan for developing that adolescent and adult autism program, which again would help benefit our region and the state. And then move forward with recruitment of clinicians, particularly, again, that's one of the reasons we set up residency programs in primary care, surgery, and our psychiatric practices to actually, if we can't recruit in, we actually grow our own. And if we do a good enough job with training, then with time we will bear those fruits and enjoy those fruits. And we're working on that. Next slide, please. And again, consolidating inpatient services. Again, we have worked and convened the work groups. We're reviewing our current inpatient care model of the separate med-surg unit and an ICU, and looking at the level of patients that are currently being treated in our ICU along with our med-surg unit, look at a more efficient model to optimize the space and actually have adequate staffing. Which has been, again, a difficult chore over these last few years of maintaining staffing. It's hard to live on locums and emergency coverage rather than people that stay for periods of time. And again, we want to ensure that we maintain access to the majority of the patients, to the majority of the people we care for today, currently in our facility. So that's the goal.
Dr. Herco, how many more slides do you have?
Last one more.
Okay.
As we go through. So surgery is the same way, since the 24/7 need, particularly that we see with labor and delivery having greater than 90% of our after-hours cases are from labor and delivery. By not having that frees up the staff to assist to increase our other capabilities for outpatient surgical services, and that's where that work group will be convened to move forward in that. That's what this is all about. It's actually improving access to care as we move forward. But again, we won't be changing anything until labor and delivery is phased out. Next line, please, or next slide. And again, labor and delivery, as we noted, we asked for 8 to 12 months to allow people that are currently wishing to deliver in our hospital to currently do that. We're working with the staff, offering retention bonuses and packages, and then even long-term employment packages after that's phased out that can be employed throughout the health system. And then finally, this is all up to how our providers and our staff, if they decide to stay during this course, regarding the 8 to 12 month period, let alone the CON process we have to go through. So it's a complicated aspect, and we're working on keeping this open throughout this entire period. Next slide, please. So again, this is we want to be an active part and an active member in our community, and work with our communities, listen to the communities as we have here. We have our website here, and that people can actually set up the meetings as we work through the various meetings in our town hall in Sharon, and other aspects of meetings throughout the various communities per the interest of people that want to meet with us in a face-to-face manner. Again, collaboration is something that we want to work with, and this is just the beginning of that long-term care and transformation plan. So thank you for this opportunity.
Thank you. And we're not going to get into a debate on the specifics. Obviously, the people who spoke earlier have very strongly held opinions, but I know, Curtis, I assume you were here somewhere. You and some of the other selectmen who are directly affected by this wished a few minutes also.
I'm hardly the spokesperson for the group, but we did have a little meeting yesterday and raised some concerns, and I'll let the others from Region 1 mention it. But in Salisbury's case, we support Dr. Herco, just about everything in that slideshow. We want to be collaborative. We want you to succeed. We see healthcare as a really vital link to our town government, both seniors and children. and it affects the volunteer ambulance crews, where they go. In Salisbury's case, we're pretty isolated, and I don't know why you would want us to send our residents to a whole nother system in Torrington. So then our choices for birthing would be really far away, Danbury or New Milford or Poughkeepsie. And and Torrington itself is pretty far away. So we're just concerned about a lot of the things that you've heard about today. I don't want to go back over it. But again, supportive of a lot of what you're doing and here to help. But that birthing one is a bit of a deal breaker for us. So I'll leave that up to anyone else from the little group of first selectmen. Anybody want to say anything?
I think I saw
Gordon has his hand up.
Sure, and again, just supporting what Curtis says, I don't think you can underestimate the importance of the hospital to these towns up here, especially going through this uneven age of COVID. We are concerned about the proposal as it stands because it just seems like less is less and less is not more. It just seems like it's less service for our communities and less business for the hospital. Right now, our people are fully invested in the new van system. We're sending people into your system to go to Poughkeepsie, but if this service is discontinued, especially in a town like Cornwall, we're equidistant to Torrington and Sharon, so that business will go out of your system. It just seems like that's not the right direction to go, because a lot of people here, myself included, we had 3 kids born in Sharon Hospital, and that's when healthcare starts, is at birth, and that continues through life. I think on the upside, the other thing that we've looked at is these last couple of years, especially this year, we've seen an unprecedented resurgence of population in our communities, part-time houses becoming full-time. And a lot of times it takes a while for those people to get their bearings and reestablish their health care. But, to the hospital's credit, we've had a doctor from New York, I know, came up to me, and he said he was so impressed by the emergency care he got at Sharon Hospital. He said he'd still be parking his car in New York by the time he was treated with excellent care at Sharon Hospital. So again, it's an excellent healthcare record. And we're just seeing a real opportunity here with the resurgence population, especially in the northwest corner. You're seeing some of the most significant population growth in the county. And I would just say it's hard to plan on 2020's numbers. And an article I read today said a lot of people have postponed their hospitalizations because of COVID. So between the changing demographics and a need for future healthcare, we would strongly ask you to postpone these decisions and look for us for opportunities to grow this vital resource to our region. Thank you.
I see 3 other selectmen and Maria Horn have their hands up. So why don't I assume they're part of the same group.
Yeah.
All right, Barbara, why don't you go first? Since you're first up on my screen there.
Okay, I'm sorry. Roxbury does not, send people to Sharon Hospital, but as a former EMT and having a lot of rides to New Milford, when they took a lot of the services out of New Milford, it changed our times from being on a call from 2 hours to 3 hours, because now we were going to Danbury. It is really a burden on your volunteers, and I wanted to just stress that. And I would just also, and so consequently, I backed off because I couldn't take 3 hours every time there was a call. And I would just like to back up what Gordon just said, and the move of people into our region. It's significant. There's just more to do. So I won't take up your time, but I just wanted to say that.
Thank you, Barbara. Henry?
Henry, we can't hear you.
why don't we come, Henry, why don't you figure out your problem? We'll come back to you. Gene, why don't you go ahead?
Can you hear me now?
Thank you.
Yeah.
Go ahead, Henry.
Go ahead, Henry.
All right, let me just turn on my back on with my video. I've served on the board of a much larger health system than Sharon Hospital. But the one thing that I will say in sympathy to Mark is that a hospital has to make money. If a hospital doesn't make money, it will definitely go out of business. But I do think that I personally would like to see a fuller report on the study that was done. What was the purpose in buying the hospital? You must have known that it was not in good financial shape initially, would be one of my questions. And I just worry about that we're comparing apples, which is pre-COVID, to oranges, which is COVID, and the effect that that has on the hospital. And I'm not sure that I understand that. I'd like to get a deeper understanding of the actual finances and how they project to change this and where they think that they'll generate the revenue. And I'm a little confused about that. And maybe they could make a stronger case as to where this is going. But I worry tremendously about our ambulance staff and the effect that that's going to have on them, and especially what happens when somebody has a serious event at 7 o'clock at night, and how will that be handled? Or do we have to transport people to Torrington? Anyway, I have a lot of questions and very few answers, but I hope that they will be a little bit more forthcoming with specifics, especially financially. Our hospital went through a period where we had to make some decisions and ended up building a few wellness centers and surgical centers outside, but that's not going to be the case here. So I just have more questions than I have answers, and I find that disconcerting.
Thanks, Henry. So we have Gene and Maria, and I see Charlie has his hand up. What I'm going to suggest is we do those three. That'll get us to about 11 o'clock. And it sounds like there needs to be a follow-up meeting, and I'm not sure who would organize it. The COG can organize it, but I think rather than occupying the 21 members, those who are directly affected and this has an impact on should participate in that. But let's do we'll do Gene next, then Charlie, and have Maria be the wrap-up speaker.
Thanks, Don. I know I fully understand the massive challenges that are ahead of any healthcare system. So I have a very brief story. I was 22 years ago. I went into labor and we had a daughter at Sharon Hospital. Dr. Mortman, it's nice to see you on this call. It's been a while. Dr. Mortman delivered my daughter. And as we were walking around the halls of the hospital, we were trying to figure out a name for our daughter. We got great care. This was just prior to the birthing center opening. We got fantastic care from the physicians, from the nurses. And so my daughter's name is Sharon. There's a reason why her name is Sharon. So with that, I think every CEO in this room wants to support the hospital keeping labor and delivery, keeping the services that this community, this larger community needs. Kent is lucky because we're close to New Milford Hospital, but there are a lot of folks in our community and the region in general that they want to have their babies at Sharon Hospital. We have so many new families in our town. I know every town in the Northwest corner has so many new families, young families. And so I have a practical question. If someone presents to Sharon Hospital in labor, what happens? And that's not a rhetorical question. If the birthing center were to close and we transported someone who is in labor to Sharon Hospital, what would happen? I think that's a practical question that I've sort of seen growing in the chat.
Mm-hmm. Thank you, Jean.
I was looking for an answer.
Okay. Dr. Herco.
I get it. You know, if the unit is not open and someone is brought in, the emergency room department, the people in the ED, the physicians are trained to deliver babies. And that's part of their training as emergency room physicians, and they're actively undergoing further. Probably rehashing of a lot of their services now that, if there's, depending on the timeline, because we're going to meet later today actually with our obstetricians just to kind of go over situations like that. So, but that's the plan at this point, if we had to. And we're following the model that other rural centers have done. You can look in the public ledger for Columbia Memorial Hospital in New York and Hudson on how they did the program, and we're very close to in regard to how they actually set up their program when they phased it out. Messina Hospital, Long Island, similar faction. New Milford's a little bit like this, but it's actually it's different in that it's closer to a larger healthcare facility. So that's why I don't want to compare apples and oranges there. So we're following more of what the rural places in the region have done. So,
and last, I think the burden that is going to happen on EMS is going to be remarkable, and it's causing a whole new skill set for volunteer basic EMS that they're not used to. And that's going to cause an undue burden on the whole system, which is fragile out of the gate. Thanks, Don, for the time.
Sure. Thank you, Jean. Charlie?
Yeah, Don, I'll just make it quick. I didn't get with the rest of the colleagues yesterday on that Zoom meeting we had, but I back all the area selectmen. I like Henry's ideas to see some finances. Gordon's and Curtis, all the selectmen that made comments here in the northwest corner, I back them fully, and I'd love to see more information on it. On that. That's it, Don.
Thank you, Maria. You, like I said, you can be the wrap up.
Yeah, and I promise I'll talk fast and I won't take a lot of time. I just first want to point out, you hear from all these experienced municipal leaders, first of all, a clear understanding of the challenges of providing services in a rural area. We all know that it's more expensive than providing services in a denser urban environment. And we all, are trying to support, a collaborative environment for Sharon Hospital because it does need partners. But there's a lot of questioning and skepticism, if I'm honest, about what this plan actually means for us. So among other things, I know the Stroudwater report, which was the third-party consultant hired some time ago with money from outside nonprofits. I just read some of that last night, and it quite explicitly does not include any of the demographic changes that have happened in our region over the course of the pandemic. It's quite clear on that. And I know at the rollout recently, someone on the panel said that, they weren't material. They're material to us. And I think I'd be interested in understanding sort of what means material to you, because you've heard also from the selectmen, we all feel those demographic shifts. In fact, Salisbury, even in the last census, is the only town in Connecticut that got younger. So, and that didn't even catch the pandemic growth that we're experiencing. So that's not factored into the report in any way. What is factored in, and I think Henry touched on this and others, is the significant impact that the pandemic had on hospitals and healthcare. And we all know that was dramatic and severe. And we're all a little bit concerned about what the baseline is here. So we're extrapolating, predicting from a base of low revenues, which have declined significantly from, I would say, at least significantly due to pandemic reasons. but not taking into account the longer term and what we hope is long-term growth in our area. And I think there's significant reason for us to be hopeful about that, particularly if we continue support services like this. So I'm a little bit, we look forward to more information about that. And I will note that it's been important to me to have more interactive meetings. And we've set up one on November 5th with the affected municipal leaders both in Connecticut and New York with Nuvance at Sharon Town Hall. Thank you, Brent. And I know that there's at least one other public meeting on November 9th, at which there'll be an opportunity for there to be actual interactive, questioning in there. And the one thing I also just want to add in here to think about is that the report also says, makes it with respect to labor and delivery that the current model isn't sustainable. And it will be important to us to understand what other models Nuvance looked at with respect to labor and delivery, because I didn't see any reference to that in there. So we understand Sharon Hospital needs a partner. We need a partner. We really want to make this work, but we need some more transparency and some better information. So thanks, Don.
Thank you, Maria.
If you'd like, I can answer like the basic questions that from the meeting yesterday that the selectmen had forwarded to us.
We're way beyond schedule. I think what we'll do is you can defer that to the meetings Maria talked about with
Sure.
the area selectmen, and I'm sure there will be a lot of dialogue at that time. I think, for many of us, we're very obviously interested in all of the towns in the region getting the best possible services they need. But I think there's some of the towns that's very, very critical to them. And those are the selectmen that, you need to meet with, and Maria and other area representatives. So I appreciate the time, and I appreciate everybody's interest in this topic. I know it's a very important topic to many of our residents, but I think we need to move on with the agenda. Next, going back a little bit in time, we have 4 selectmen who were not running again. And a couple of them, well, 3 out of the 4, I'm finishing my 14th year, and I worked with them since I got elected. I know Barbara has a few more years than I do in the job, but it's been an extreme pleasure, working with Bob Valentine, Barbara, Tim Angevine, Tom McKeon for me, and for many of the selectmen. And they're going to be missed. Their knowledge, their insights, the sharing of ideas and concepts that we've done over the years has been invaluable. So I don't know, Rob, if you had anything else, but I just want to thank those 4 for their service. And if they're interested, I think we're going to do a little ceremony in December. If we were all meeting in person, there would have been, I know Rick in the past has done a toast with sparkling cider since, we're not drinking at 11 o'clock in the morning. But I think there's going to be a little ceremony at the December meeting, which we're going to try to do in person for a couple of other people who are retiring from the COG staff. But if the 4 of you would like to come to that meeting, we can honor you in person and appropriately. Rob, you want to add anything to that?
Dawn, can I just add very briefly?
Sure,
I just wanted to note that each of the retiring chief elected officials will receive this very exclusive COG Living the Dream mug that cannot be found in retail stores or online. So just as a token of our appreciation for your service to the region and to your town.
Jocelyn, you missed your calling.
Thank you.
I know.
I'd just like to say thanks. I've been first selectman for 24 years. I was on the board of selectmen for 4 before that, and 2 on the board of ed. So it's a 30-year run. But I can tell you the COG has been invaluable, and not only for information and sharing, but friendships and relationships. It's been just great to be able to connect with all of you. I'm sorry that I'm going to be leaving the golfing group because I beat all of you every time. I barely find the ball, but anyway, thank you very much. It's been a great run. And I would love to be there in December.
And if you notice, Rick sent out a golf invitation for one more little golf outing while the weather was warm, so you better be there.
Okay, all right.
Anyone else?
Well, I would just say beyond their electoral success, I just look to the long-term memberships and the skills they bought. It's obvious why their constituents continue to reelect them, because they were good at their job. And watching Barbara and Bob and Tom over the long term and really just getting to know Tim, it's no surprise to me that they were successful in their communities. And I, being here for a while, kind of watched Barbara and Bob and Tom do their thing and kind of went to school on them and appreciate the things that I learned from them, and thankful for getting to know them. So,
Yeah,
good luck.
absolutely. I'm
Thank
so
you.
grateful for the long term of the three as mentors, as a new chief elected official. And it was great. It's been great to have Tim as a neighbor, but I really, really just appreciate all the experience that they brought and how they were always there to, offer some pearls of wisdom to us newcomers.
Just think, now we got to harass Gordon and Curtis for all our stuff, right?
Right.
As the senior deans of the COG. Right? Am I missing anybody else?
Yeah, so I'd just like to say, as a senior dean, one thing that's remarkable about these people is not only they take care of their towns, but they went outside their towns. Sometimes I'd accompany them to Hartford or wherever we had to go to try to advocate for these towns in the bigger picture, and they did that successfully. They didn't have to do it. You could just stay home and take care of business at home, but these people went outside their towns, repeatedly all the time, just keeping track, trying to make it easier for our towns to be what we want to be, and interject some common sense into the political process, and also to keep things bipartisan, which is, this area has always had that tradition, and certainly these people carried that forward, and not being able to tell who was a Republican or a Democrat at the table is a real treasure, and they just kept that going. So anyway, we'll be seeing you around, but anyway, thanks for everything.
Thanks, Gordon.
Yeah, I'd just like to say that for my brief tenure here working with you, it's been a pleasure. Obviously, when you're losing that kind of institutional knowledge, I like to say it's a perceivable loss, obviously, for the group, but everybody I've run into so far has been saying the same thing as far as bipartisanship and just doing things for the good of the group. Best of luck.
Are you going to stay silent over there?
I just have to agree with Barbara. It's been a pleasure working with everybody over the years. Met a lot of good people that have come and gone, and wealth of knowledge that you get from everybody is an asset to any first selectman. And know that whoever follows me stress them the importance of the COG and the knowledge that they can get and information they can get. And it's just been a great pleasure working with everybody, and looking forward to retirement.
Thanks, Tom. Tim, we'll give you a chance too as the short timer.
Short time. Yeah, I just want to say thank you to everybody at COG, and also all the selectmen and women on these meetings. You all have been helpful in a number of different ways, but also a very bright spot in this whole wild experience the last 2 years. So thank you all. Thanks, Don.
Thanks, Tim. All right, next up is the report from the executive director. I know Carolyn Mastro asked a number of detailed questions. What I would ask her to do is, we're not going to go into the level of detail it sounded like she was asking for in this meeting, but if you could send Rob an email with your specific questions, he and I will make sure you get full set of answers. I think what we're going to have to do at this point is give the top level view, but we're certainly willing to answer specific questions or concerns as they arise. So Rob, if you could do what you plan to do, and then we'll address those other concerns and questions in more detail.
Yeah, I'll just try to be as brief as I possibly can, given the interest of time here. You'll see in the packet that I had sent out the annual report for the RSG funding, which is our #1 funding source. And it is only one funding source that the COG takes in on an annual basis. Just a quick 10,000 foot overview. Basically, this is a nonprofit. You know, we have grant funding sources that come in. We have local dues that come in from the member municipalities. We then allocate our staff. We all have annual salaries that are fixed and obviously updated on the annual basis like anybody else. And what we do is we basically allocate our annual hours to these different grant funding sources, depending on what staff member is working on what project or under what grant source. So that's pretty much the gist of it there. I can tell you that at no time, as far as with regard to consulting, at no time was there ever a conflict of interest. Essentially, that fee for service work was basically just brought outside of the COG, and that actually frees up some hours for staff time, which is available to work on other projects that the COG does on a regional basis, which is helpful to me. I know that there's some talk out there that maybe some of my comments have been misconstrued, but again, there's no conflict of interest issue. There wasn't before and there isn't now. On that note, as far as staff, as many of you know, Darlene is retiring at the end of the calendar year. We have her job position out posted on job boards at this time. It started last Friday. Hoping that we get some good quality candidates. So if you know of anybody that might be interested, please share that posting. And also we have Jocelyn is going to leave us from the COG, although she's not disappearing from the region. So she's going to be planning on transitioning out at the end of the calendar year as well too. I don't know, Jocelyn, do you want to say a couple of things on that at this point in time?
Sure. I'll just note I'm leaving to direct a new Litchfield County Center for Housing Opportunity. So hopefully I will be working with all of you with my new hat on, trying to help you all both develop and or implement your housing plans. So that's all. And so I'll be here through December, and after that, I'll just have my new hat on, and hopefully I'll be able to come back to some of these meetings and update you all on what we're working on at the center.
Thanks, Jocelyn. Yeah, obviously that's a new partner for us that we can work with. And on that note, we'll have to see what we're going to do as far as staff transition with that role here in the COG too as well. It's going to be determined. A little bit more analysis needs to be done on that. And with that, I'll just wrap it up so we can keep moving along unless anybody has any questions.
No questions? All right. Thanks, Rob. And like I said, if Carolyn Mastro wants to send an email with specific questions, we can respond to that.
Can I just make a comment, because I won't be at these meetings after today. And I just wanted, I don't think I am, my last day is the 15th of November, but I cannot tell you the invaluable service of Darlene and Jocelyn to the town of Roxbury. And Darlene, I'm going to miss my calendar that you always buy for me. I may be one of the last ones that still use it. But like you said, Rob, the institutional knowledge and value is going out the door with them. And I just wish everybody good luck. It's all new relationships. It's turning the page and moving on. But I wish you both the best. Been great working with you.
I'm a little baffled, Barbara. If you're retiring, why would you need a big paper calendar? You should have free days to do whatever you want without keeping a calendar.
No, I just thanked her for all those in the past. I don't need it anymore. You're right. Blank, blank, blank.
You need something to put the mug on.
That's true. All right, with
Yeah,
that.
just thanking Jocelyn for working at the Northwest COG when we were a separate agency, and just coming to our town to help us with housing. These aren't easy issues, but just showing up and giving expertise to those, and it's no less an issue than when we started. So again, just having that ability here year after year, she helped us pull together our town plan, which is excellent. Again, thanks for everything.
We'll certainly see her in December. But thank you, Gordon. Anybody else? All right, moving to Rob Rubo with a COVID update.
Hi, good morning, everyone. Thank you for having me. Jocelyn, am I able to share my screen?
Yes, you should be now.
Okay. I'm going to try and keep this pretty brief because I know we're pressed with time here. I was going to give you first a local update, a report that we send out on a weekly basis to many of our towns. Also go over a few of the state numbers and just a couple of things that are on the radar in the near future as far as COVID is concerned. Let's see here. Okay, can everyone see that?
Yes.
So what we do here at our district on a weekly basis and send out to all of you as well as our school superintendents, we break down per town that we serve, basically your positivity rate per 100,000 population, and you'll see the different categories here as far as the total number of cases, the positivity rate, the reporting period, and this one was just updated as of October 7th. The good news is in the Northwest corner, we're actually doing really well. Many of our towns have come out of the red status and are actually in the gray. They're not even in the yellow. We have a few towns that are still in the red or in the yellow, but many are in the gray area, which is great news. The other thing we do with our report, if I could scroll down here, we pull off of the state site the percent of the population that's vaccinated per age group. The one piece that has really helped tremendously this year as far as the schools are concerned, if you look at the 12 to 17 age group, and that'll be the first one for each town, they're anywhere from low 40 percentages to 50 to 60% vaccination rates. Although that does not seem very high, if you think of it from a contact tracing perspective, when we have a positive case in a school, it's practically every other student now between the ages of 12 and 17 that would even be considered as a contact. As most of you are probably aware, if you're fully vaccinated and you have contact with a positive COVID case, you do not have to quarantine as long as you remain well and stay symptom-free. So this is a report that we send out every week to our chief elected officials, school superintendents, and it really helps guide them as far as what's going on in their communities and any other mitigating strategies that they have to take. Okay, I'm going to try and share another screen. Okay, so every Thursday, and this one is actually from last week because it doesn't get released till about 3 p.m. The state of Connecticut releases a very detailed report. It's not the one that you see every day, but if you go on their state website, you'll actually be able to get this detailed report, and it goes into many categories. And there's just a couple slides that I was going to go in a little bit more depth, but due to the time constraints, I'm just going to really try and highlight a few slides. The first one, I know many of you are hearing about the breakthrough cases. So in the last 7 days, you'll see, and this number really hasn't fluctuated, about 30% of our new cases are among fully vaccinated individuals. And a lot of people get alarmed when they see that. However, I do want to point out that although these individuals may be breakthrough cases and are getting COVID, many of them are very mild symptoms. So the vaccine is working. The one thing we like to tell people is try and relate it to the flu vaccine. If you get the flu shot, most of the time, if you do get the flu, it's going to be a much milder version of that. And that's really what this COVID vaccine is doing. So some of those breakthrough cases, although they're still cases, they're very mild. We're not seeing many of them in the hospitals. We're not seeing many of them die or even develop severe symptoms. So the vaccine is working. And then you'll see that the individuals who are not fully vaccinated accounts for roughly 70% of the new cases. Just want to scroll down to trying to look for a map I wanted to show you. So when you heard me before talk about towns that are in the red, the yellow, or the orange or gray, you could see here Northwest Connecticut is doing really, really well. The gray indicates less than 5 cases per 100,000 population. So you'll see we have a few towns in the northwest corner that might be in the orange or the yellow, and a couple even in the red. However, the one thing I also want to point out with that, when you have a town that doesn't have a large population, like one of our major cities, just a few cases could really bump your status into orange or red. So sometimes it's good to also look at the raw numbers versus just the rates. And I just wanted to point out one more thing. You heard me talk about how the vaccine is working when it comes to hospitalizations or deaths. So this little chart here is cases and deaths among fully vaccinated persons by age group. So you'll see from age group of 34 or below, there's been no deaths at all. You'll see this is the percentages of new cases amongst those age groups who are fully vaccinated. And even if you start to come up, even 54 or below, there's been only a few deaths amongst fully vaccinated individuals. And we have been told by the state epidemiologist, a lot of the individuals who are passing that are fully vaccinated have other underlying health conditions that contribute to that. And then just the last thing that I do want to point out in the state report, this one piece of information here, compared to being vaccinated, being unvaccinated currently has the following relative risks. If you're unvaccinated, you're 5 times higher risk of being infected with COVID. You're at 5 times higher risk of dying from COVID, and you're 42 times higher risk of being hospitalized with COVID. So even though we're seeing some hospitalizations due to COVID, another important piece of information that I want to point out, whenever a patient is admitted to a hospital now, they're tested for COVID regardless of symptoms. So many actually of the hospitalizations that are listed as COVID hospitalizations amongst fully vaccinated individuals are individuals who may have gone to the hospital for some other reason, receive a COVID test and pop up positive, but they may also be asymptomatic. So this number is actually probably even higher than what's shown here. Just trying to pause to stop share. Okay. And then just a couple other pieces of information that I wanted to point out to all of you. I'm sure many of you have heard about the booster shots. Currently, only the Pfizer vaccine has been approved for emergency use for a booster. Moderna and Johnson & Johnson are still under review. We're hopeful to see something by the end of the month for those 2 vaccines and the booster doses. And the booster doses have only been approved for individuals of 65 years of age or older, or individuals who are at risk for a severe illness. And I just have one other update. The Pfizer vaccine has been submitted to the FDA for approval of emergency use for individuals of 5 years of age or older. The state epidemiologists are telling us that we could see that approval by the end of October, potentially a rollout for early November. Again, this is going to help our elementary schools tremendously, because if we see the same amount of vaccination rates amongst the elementary school kids, or the 5+, that will reduce the number of kids that we're going to have to quarantine when we do have those positive cases. And with that, I'll just open it up to questions if anyone has any questions.
think you must have done a very thorough job there, Rob.
Thank you.
Thanks, Rob, for all the information and all the amazing support throughout this whole.
Yeah, several of us are in the
Fine.
Farmington Valley Health District, and I will comment that we get the same data from them relative to infection rates in town and new cases and vaccination rates. So the health districts have been invaluable during this process.
I would like to just congratulate Rob and his staff for doing a fantastic job over the last 18 months.
Yeah.
You really have, Rob.
Thank you. I appreciate that.
All the phone calls from, I'm sure, every one of us at night, on the weekends, that you pick up and help us all with we're beyond grateful.
Okay, so we now have an hour and 10 minutes worth of information to do in 30 minutes. So we're going to do a sprint here. So next up, of course, we'll give John all the time he needs because he also, like Rob, has put in invaluable service during this process. So John, you're up next.
Thanks, Don. I appreciate it. And I just have to, I'd be remiss if I didn't say to Bob, Barbara, Tim and Tom, it's been such a pleasure working with you guys. And I've known all four of you for many, many years and worked together on many, many different projects. So I really appreciate all your guidance and all of what you've done for your communities over the years, and really appreciate that. Same with Darlene and Jocelyn. I wish you nothing but the best, and it's such a pleasure. It has been such a pleasure working with you all, that's for sure. So COVID related, long-term recovery, we continue to collect projects, economic projects, working with FEMA and trying to get those particular projects submitted into the portal. We have till the 15th to do so, which is tomorrow. So we continue to work on trying to do that. Also, we have been given some guidance in regards to the American Rescue Plan Act funds. At least we have a contact now through DECD so that we could ask many questions have come forward. So if you do have questions, I do have a contact at DECD, which can help quite a bit. As we all know, the executive orders now have been extended out to February of 2022. And then currently we stand for public assistance on the COVID response. Public assistance reimbursement funds, we stand just around $180 million for the state of Connecticut right at the moment. So some significant funds being distributed and being sent out to the municipalities in the state here. Under regular business on Ray, we did some PDA, IDA stuff, preliminary damage assessments or individual damage assessments. And unfortunately on Ray, we did not meet thresholds. So there will be no declaration for that particular storm, which leads us over to Ida, which we're still working on collecting data right now. It's so important if you did have damages due to Storm Ida, that you get those submitted into the portals. FEMA is actually collecting that data right now and going over it with the municipalities to assure that we can obtain a declaration, official presidential declaration, and get some reimbursement for those costs. Unfortunately, yesterday I found out that Connecticut DOT numbers, which we're using to meet our threshold in Litchfield County, are not qualified to go through FEMA public assistance. They're actually going to be going through federal highway organization for funds. So we need all the help we can get to get Litchfield to the point where we meet that threshold so we can get some reimbursement here. Also, IA, we're working on, the state is working with individuals who have submitted losses for the Storm Ida to hopefully meet the individual assistance thresholds also. We're working that through. Working on EMPG, radio collection, still trying to follow up on a couple of radios. We do have a regional emergency planning team steering committee meeting on Monday. So we'll be selecting some new chairs and all that kind of stuff. We have a couple vacancies there. But we have that meeting also through the Homeland Security Grant Program. They did provide each region with a supplement of $60,000 more. So we'll be having some discussion in regards to what we're going to do with that. And then we continue to collect the LEOPs and the local emergency operations plans and the school security plans and drill logs as is required for each of the municipalities and school systems. So I think that's all I have, pending any questions for right now. I'm trying to keep it short.
Thank you, John. Any questions for John?
Thank you, guys.
Just like to say one thing. Thank you, John, for your kind words to all of us that are leaving. And we do have your phone number for storms. I'm going to send you my address.
Okay. Sounds great. Thanks. Thanks, Barb.
So you're Selectman Emeritus, Barbara?
Something like that. No, I'm just being open about what I'm going to do.
All right, yeah, next, Jocelyn, want to give a recap of the summit we had at the Five Points Gallery?
Yeah, I'll just do the 1-minute version. We did have a successful 5th annual Economic Development Summit last month at the 5 Points Art Center. I do want to thank the Mayor Carbone for sponsoring a tent for the event, which came in handy because of course it rained. But I think many of you were there. Thank you for coming, and hopefully you availed yourself of the food truck or the beer the beer tent we had there. We did have over 100 folks registered and attend the event. And again, the purpose of that is really to let everyone know what we've been doing to implement our regional economic development strategy and how towns can participate. We did have DECD Commissioner Lehman come. He did speak about what the state is doing that affects our region in terms of COVID economic recovery. But the other great thing is he stayed and listened to all of our other speakers in terms of, you know, what's important to our region in terms of economic development and economic recovery, including, you know, our fiber to the home broadband initiative, our food hub, our Discover Litchfield Hills website, our new young worker videos. So it's good to have him hear all of that, as well as the 100 or so folks that attended, and our reps, Maria Horn and Michelle Cook, were there as well, which was terrific. And just as one follow-up note, I do want to say, in terms of regional economic development strategies and next steps, as you know, we did hire a new broadband outreach coordinator, Kitty Kiefer, and she is going to be setting up meetings with each of you, hopefully each chief elected official, to share with you the cost estimates we have for each town based on different business models in terms of, you know, getting you set up with fiber to the home. So just be on the lookout for an email from Kitty so she can, you know, have a virtual meeting with you or in person to walk through those cost estimates with you and answer your questions. That's all.
And I will thank Jocelyn for all the effort she put into the event. And it didn't just rain, it poured. So we were very lucky to have the tent, but I think the seminars that took place, I think, were useful to the folks who were somewhat new to what we're trying to accomplish in the region. But Jocelyn put in untold hours along with all the housing plans she was working. And she looks much more relaxed now, so that's good.
Sorry, I missed it. I know I must have had a selectmen's meeting or something, but I would like to have gone.
Well, there was a goodly number of selectmen there, which I think was helpful also. Rob, you want to just summarize the Household Hazardous Waste Day?
Sure, I'll try to make it less than 1 minute. We had a successful event on Saturday the 9th. It's at the middle school. I think we had about 450, 460 vehicles that came through to deposit their hazardous waste. Thank you to all the participating towns for getting the word out. And also special thanks to our volunteers that came and assisted us. Cindy Barrett, Paul Collins, Jim Hilton, Lucy Hussman and Darlene. And the next two, and again, I wanted to mention Clean Harbors was fantastic. They were very, very organized. The site was nice and clean when they left. Was very happy with their service. And the next two dates are, the next one would be in Falls Village on June 4th of 2022. And then the fall one would be on October 8th, hopefully at the Torrington Water Pollution Control Facility next year as well too. So if anybody has any questions, I'll take those now.
Okay, moving right along. Next item is request for endorsement of a Greenway Trail Grant application. Denise, are you going to talk to that, or is there someone else here who's going to?
I don't think Berta is on. She had a conflicting 11 o'clock meeting, so I can say a few words about it.
Sure.
Absolutely. So the Friends of the Litchfield Community Greenway it was actually a brainchild over 20 years ago, but starting in 2007, they formed an official nonprofit, and ever since then they have been securing easements, securing grants. They are finishing up phase 3, trying to get into phase 4 that will connect Litchfield to Bantam and get people off the busy Route 202 corridor, and also allow our students to get from the Litchfield school system to the Wamogo school system, because they share a lot of classes. And as you might expect, doing this is not inexpensive. I think their submission was over 600,000 for the next phase. And, they have to go through a lot of the processes of the inland wetlands and the planning and zoning, hiring site engineers and putting in structural implements to make their crosswalks safe with visual lighting. So I hope that the COG will look favorably on this application for the recreational trail and greenway grant.
I'll make a motion to endorse it.
I second the motion. I just want to say I made the unfortunate decision to print out the thing and read it. So I second it.
Thank you both.
Any questions for Denise? All right, Jocelyn, are we going to just do a raise hands, or are you doing a poll?
I do not have a poll set up, so we'll do raise hands.
All right, so if everybody has a little raise hand thing down at the bottom of the screen, why don't we do that? So all in favor? All right. Did you get a counter, Jocelyn? It looks. Curtis put his hand up physically.
I can't see it, but I'm in favor.
Oh, yeah, I was gonna say, you put your hand up physically. I saw that. Charlie, are you voting yes or? Okay. All right. Everybody, if they can lower their hand, anybody opposed or?
And maybe opposed could do thumbs down if there are any.
Yeah, you can lower your hand on your screen if you put it up.
I'm good. I'm good on my end.
All right.
Thank you,
All right.
everybody.
It looks like there's nobody opposed. All right. Next is the approval of the minutes from the September 9th meeting.
So moved.
All right.
I'll
Second.
second it. I'll second it.
Any corrections, additions, changes? All right, let's take a vote the same way.
I don't know where I went.
All right, I saw Curtis put his hand physically up.
I got it now too.
Okay. Yes, along the bottom of your screen.
Good.
I got it.
Okay. All right, if you lower your hands, we can see if there's anybody opposed, or you can speak now. And all right, looks like that passed. Next item is the approval of the financial statements for August. That's Henry, second.
Second, Curtis.
Curtis, okay. Any comments or questions for Darlene or Rob on the financial statements? All right, again, let's take a vote. We'll do the raise hand thing. And Looks pretty much like everybody voted yes. Okay, no, anybody opposed? Any abstentions? All right, so next up is the information sharing. We won't call on every town, but if there's anybody who wants to comment on what they're doing in town hall for COVID, what they're doing, how the schools are doing, it doesn't have to be just COVID, but any information that we think is appropriate to share. In the past, we've gone around the room, but we don't really have time to do that. But I will comment that we're hoping to be in person in December, assuming the trends continue the way they are. Rob was hopeful that the conference room, I don't know if you're still confident on that, Rob, that the conference room modification will be done. So hopefully it'll be a bigger space and a nicer space to have meetings in, but you know how construction goes these days with lead times. But the plan is to meet in December. There's no meeting in November because of elections. Is there any info sharing want to take place?
Don, I'd like to thank everybody who's put in the time and is leaving, and particularly Barbara. I remember the old days, Barbara, when we were down in Warren. Do you remember that? There's 6 of us or something.
How could you forget?
Goes pretty far back. So thank you for all the time and camaraderie. And I would like to make a motion that we give Barbara one of these brown books for 2022.
I would second that motion.
Okay, very good.
I'm sure Darlene took note for the minutes.
Anyway, thank you all.
Thank you. I just want to give a shout out to our elementary school. It made #1 in Connecticut in Newsweek. So
wow,
really proud of that, actually. We're in a region of 3 elementary schools, but Roxbury is #1. So
then I have to give a shout out to Regional 7, which is one of 4 high schools in the country to get a Blue Ribbon Award. So they got national recognition. So I think between Roxbury and Regional 7, we should be proud of our schools.
Yep. Yep.
Absolutely.
And just thank you again. You know what? I mean, I've been chairman of this COG and have had different faces over the years. I mean, I remember Allie Chapin, and there's just so many different people and great relationships that stay on even after people are not there. So I hope that we can do that also. Thank you again.
Thank you all. All right. And I do thank everybody for listening to the story about the Sharon Hospital. I learned a lot because it's not something I'm familiar with, being in the eastern part of the region, but it sounds like there's a lot of work to be done to keep that resource available to the northwest corner. So thank you everybody for listening to the story and the folks who were online for this. Anything else, for any other business to conduct?
Yeah, just real quick, I just want to echo what everyone else is saying about Barbara, Bob, Tom, and Tim, and Darlene. Thank you for all your work, your service. I did try reaching out to Bob today, excuse me, but of course he was on vacation. So they told me to call back next week, so I'll set aside a couple hours to get a question answered.
I think he's actually hunting right now. He takes an annual trip out west. I don't know if that's where he is at the moment, but.
And Jocelyn, we'll still see, I guess, through the end of the year and see you after that. So thank you very much.
Just one other thought on the Sharon Hospital business. I think that highlights why we have a COG and why COG is so useful to us, because we are stronger together than we are individually. So again, it just highlights the hours that everybody puts in to make this organization work, and why all our little towns need it and our cities need it, So again, just getting us on the same page, which we are most of the time, is really important because it amplifies our ability to keep things going. So thank you all.
And I would echo that. And I know there was a comment earlier about being a nonpartisan organization. It took me 5 or 6 years, and I'm still not sure of who's what political party, because it's a COG. The politics go away and we're all working for the common good. So I think you're absolutely right, Gordon. All right, with that, motion to adjourn. Henry?
So moved.
Second.
All right, thank you, everybody, and we'll for those who golf, we'll see you in a couple of weeks. And for those who don't golf, we'll see you back in December, hopefully in person. Thank you all.
Thanks,
Thank you.
Don.
All right, thank you.
Good one.